Now, it's Men's Health Awareness Week, and today we wanted to explore prostate cancer risk. Now, this is the commonest cancer in men, and it affects around 1 in 8 men in the UK, rising to 1 in 4 in high-risk groups such as black men or those with a strong family history. So let's talk about some of the facts, because it's a minefield of information out there. Firstly, we don't have a dedicated screening programme in the UK for all men. Now, typically, we will look at the diagnosis of prostate cancer initially using a blood test, which is called the PSA, prostate-specific antigen. And this blood test is a blunt tool, but helpful. Unfortunately, a small number of patients with a normal PSA still have prostate cancer. And the majority of men who have an abnormal PSA reassuringly don't have prostate cancer. But you can see why this tool used alone can be controversial when screening is considered for all comers. Think of it as a stepping stone to needing further tests. Secondly, prostate cancer doesn't have a reliable symptom, so we shouldn't be encouraging men to wait till symptoms develop before testing is necessary. We need to be a little bit more proactive. Finally, prostate cancer, if found early, the outcomes of treatment are excellent. In fact, some men can choose to avoid treatment or delay it until absolutely necessary. But a small portion, around 14% of men who present with prostate cancer in the current day, are diagnosed with more advanced, more difficult to treat prostate cancer. So doing our best to identify things early should be where we need to focus. So if you're a man aged between 45 and 75, have a chat with your GP about the pros and cons of these tests. Alternatively, visit us at the Prostate Health Clinic, where we combine a PSA and an MRI scan to reduce that grey area and provide you with a personalised prostate cancer risk. So men, have the conversation.